Ticks are a common problem in the summer months, especially if you're out and about in wood areas. But do you know the signs and symptoms of tick bites and what to look out for? Hi there, I'm Dr. Michael K. from the Center for Functional Health, and today I want to talk about ticks and tick bite prevention. Tick bite prevention is incredibly important as an infected tick may carry Lyme disease and other known pathogens, which can then result in a number of health complications. Knowing the signs and symptoms of a tick bite is key. Ticks. Nobody likes hearing those words at all. They're small, they hide in plain sight, and they can carry a host of pathogens. The most well-known disease that ticks can carry and infect us with is Lyme disease. If you think that you may have been bitten by a tick, here are some signs and symptoms I want you to watch out for. You may notice a small bump or redness at the site of the tick bite. Now this will occur immediately and often resembles a mosquito bite. The next thing I want you to look out for is a rash. A rash is common and the area may feel warm to the touch. This rash sometimes clears as it enlarges, and this results in a target or a bullseye appearance. Next, you might also experience symptoms like fever, chills, headaches, fatigue, muscle and joint aches, and even swollen lymph nodes. This also may occur. Now, if you notice a tick that's attached to you, gently remove it with a pair of clean tweezers, place it in a plastic bag and freeze it. This tick may be tested. A blood test may be performed on you in order to determine if Lyme disease is actually present. Now, if you experience any of the above symptoms, please consult your doctor or your healthcare practitioner and inform them that you suspect that you've been bitten by a tick in order to get the care that you need. Now listen, tick bites can be serious and they can be scary, but being proactive is important. If you suspect you've been bitten is the key. If you think you've been bitten, please contact your doctor. Okay. You're out and about in nature, you're enjoying the summer and the warm weather, and the one thing you need to remain cautious about is ticks. Hi there, I'm Dr. Michael K. from the Center for Functional Health, and today I want to talk about ticks. Tick bite prevention is incredibly important as an infected tick may carry Lyme disease and other known pathogens which can result in a number of health complications. Do you know what to do immediately if you suspect that you've been bitten by a tick? Getting a tick bite can send anyone in panic, and I don't want you to panic. Although not every bite from a tick transmits infection, all bites should be evaluated carefully. Early detection and treatment are critical primarily to prevent medical complications of Lyme disease, which is the most commonly transmitted diseases from ticks. If you discover a tick attached to you, don't panic. Remove it carefully, and if possible, save the tick in a plastic bag and store it in the freezer. This will preserve the tick and allow you to present it to your physician. It's then advised to visit your physician and have an antibody blood test performed and monitor your symptoms closely. You might experience symptoms like fever, chills, headache, fatigue, muscle and joint aches, and even swollen lymph nodes. However, symptoms of Lyme disease may occur days to months after the initial tick bite. The most common treatment for Lyme disease is, of course, antibiotics. Now you can support your recovery with the addition of natural supplements and foods that boost the immune system. This includes foods that are rich in vitamin C, vitamin E, antioxidants such as berries, leafy greens, as well as garlic and healthy fats. Tick bites can be serious and scary, but being proactive if you suspect you've been bitten is the key. Okay, we'll see you in the next video. Stay healthy and strong. Take care. If you're an outdoorsy person and you love the summer, be vigilant of ticks. Hi there, I'm Dr. Michael K. from the Center for Functional Health, and I want to continue talking about tick bite prevention. Tick bite prevention is incredibly important as ticks may carry Lyme disease and other known pathogens which can result in a number of health complications. So how can we prevent tick bites in the first place? So whether you're camping or you're cottaging or you're just taking a walk in nature, you must remain vigilant of ticks. These small bugs can carry a host of pathogens including Lyme disease, which if left untreated can cause several health complications. Now you can lower your risk of contracting Lyme disease and other pathogens from tick bites with 4 simple precautions. Do your best to avoid areas where ticks hang out, and this is like bushes and long grassy areas. Next, be sure to dress in long pants and light colored clothing. That's really important, especially if you're going to be in areas where ticks are present. Next, use natural repellents or certain essential oils that work well. Next, inspect yourself for any ticks when you get home and take the necessary precautions that you need to do to discover if there is a potential tick bite. Now, if you suspect that you have been bitten by a tick, don't panic. Remember, remove it carefully if possible, save the tick in a sealable plastic bag and store it in the freezer. This will preserve the tick, and you can present the tick to your doctor, and hopefully your doctor will examine you and perform an antibody blood test and monitor your symptoms closely. Tick bites can be serious and scary, but being proactive is important, especially if you suspect that you've been bitten by a tick. And if you have been bitten, please contact your doctor ASAP. Alright, that's it. Stay healthy and strong, and we'll see you soon.